Hey guys, today we're going to talk about cognitive impairment and what you can do to prevent it, including some natural ways of doing it. Cognitive impairment occurs when a person has difficulty remembering, learning new things, concentrating, or making decisions that influence their daily life. This condition can range from mild to severe. People with moderate cognitive impairment may perceive changes in cognitive abilities, yet continue to do their daily tasks. Extreme levels of impairment can result in the loss of the ability to understand the meaning or relevance of anything, and the ability to speak or write, resulting in the inability to live independently. Having said that, let's get deeper into this topic by first learning where the condition originates from. Welcome to Wellness Wonders. On this channel, we'll talk about getting healthy, utilizing both the conventional Western medicine and the more holistic and integrative approaches advocated by the Eastern medicine tenets. If this is something that appeals to you, be sure to stay around for more content like this. Now let's dive into the main topic of today's video. Cognitive decline or deficits can be attributed to the destruction of neuronal tissue. Injury to the parietal lobe of the brain, for example, can result in the loss of visuospatial function or inability to dress. Damage to the frontal lobe symptoms can result in impairments in planning and abstract comprehension. An injury to the temporal lobes can result in memory and language deficits. This damage is caused by neurotoxicity, which can result from metabolic abnormalities, heavy metals or other toxins, infection, ischemia damage from a stroke or hemorrhage, and direct injuries such as head trauma, cancer, or surgery. There are several phases in cognitive impairment. Phase 1 is no cognitive impairment, or NCI. In this first phase, people experience no decline in intellect or complex skills that rely on their cognitive capabilities. The NCI stage describes natural aging, as well as those with a cognitively disabling illness that is not severe enough to cause any decreases in their abilities. The next phase is subjective cognitive impairment, or SCI. In this phase, perceived or subjective loss in cognitive or functional abilities does not interfere with an individual's normal or most challenging activities. Individuals are aware that some abilities have decreased, but can still compensate to accomplish what they want. The SCI stage characterizes normal aging and individuals who are gradually becoming more impaired due to a cognitive deficit. For example, Alzheimer's disease SCI lasts for more than 15 years. Phase 3 is mild cognitive impairment, MCI. In this phase, a decrease in cognitive abilities such as language, memory, reasoning, judgment, or perception is not caused by normal aging. Individuals with MCI can drive, shop, cook, pay bills, manage finances, do homework, and perform other well-learned tasks that do not require learning new information. This stage is not prevalent in typical aging adults and is caused by one or more cognitive defects. The MCI stage of Alzheimer's disease lasts an average of 7 years. The final phase is dementia. People in this stage are less able to do important daily tasks like cooking, grocery shopping, going to familiar places, paying bills, doing housework or home repairs, or doing hobbies or interests they know well. The dementia stage affects even more well-learned abilities, such as basic activities of daily living, such as bathing, dressing, using a toilet, and planning to use the bathroom so they can get there on time. In the end, dementia makes it hard to walk, talk, swallow, and control the body. The dementia stage of Alzheimer's disease lasts an average of 7 years. Now that we've seen the different stages of this condition, what are some of the causes and presentations of the condition? Let's talk about that in the next segment. But before we move on, if you're enjoying this video so far, please hit that subscribe button for more content like this. It would really help our small channel grow, so we can make even more videos for you. Cognitive deficiencies can occur at birth or later in life due to environmental variables, such as brain injury, mental disease, and neurological disorders. Not every elderly person will have a cognitive deficit, but cognitive deficits are more common among the older population. Some of the reasons for short-term or reversible cognitive impairment include diseases such as urinary tract infection or pneumonia, vitamin insufficiency, dehydration, and reactions to drugs or anesthetics. Various factors, including stroke, delirium, dementia, depression, schizophrenia, persistent alcohol use, substance addiction, and brain metastases, can cause long-term or permanent cognitive impairment. Depending on the severity of the symptoms, evidence of cognitive impairment can be both visible and subtle. In general, survivors of critical illness who have cognitive impairment may tend to forget about things like doctor's visits and social gatherings. In conversations, they ramble and lose concentration. They may employ sloppy judgment in their day-to-day lives. They feel easily overwhelmed by chores or responsibilities that were once simple to manage. They need help managing money or prescriptions. They make careless mistakes. And they also tend to make rash decisions. Now let's take a look at the diagnosis and the treatment process for dementia. To determine whether someone has cognitive impairment, health providers may conduct questions to assess memory, concentration, and understanding. The history compiled from the patients and accompanying family and friends should focus on changes in cognitive functions, functional status, like cooking, testing, hygiene, finances, physical manifestations, for instance, nausea, vomiting, vision, hearing, speech, balance, gait, sensation, and motor functions. Psychiatric symptoms like mood changes, behavioral and personality changes, and current medications, if any. Cognitive impairment can sometimes be treatable, but not always. Yet there may be solutions to improve cognitive impairment or lessen its impact. Here are some examples. Management of mild cognitive impairment focuses on promoting functional status. Physiotherapy is also beneficial, including exercise and physical activity, sleep hygiene counseling, and relaxation techniques. Another method used is occupational therapy, to educate patients on various methods to reduce the impact of cognitive impairment on their daily lives. Environmental methods, such as minimizing noise around the patient, aid with task focus and reduce distraction, confusion, and frustration. They ensure that the patient is surrounded by familiar objects and surroundings. Last but not least, psychosocial support for families and patients. Psychosupport for patients and families have been shown to improve outcomes in terms of clear knowledge and correct management of the disease, improving the quality of life for everyone concerned. Also, you may be able to improve the state of a patient at home with some readily available natural remedies. Various herbs and spices may benefit brain health, and some may already be in your refrigerator or pantry. Here are some of the natural remedies that have been shown in scientific research to benefit the brain. Number 1, cinnamon. Cinnamon has a long history of use in cooking, aromatherapy, and herbal medicine. Cinnamon has been shown in studies to have cognitive benefits, as well as anti-inflammatory, anti-cancer, and immunomodulatory characteristics. Some research indicates that cinnamon may have neuroprotective properties, including protection against Alzheimer's disease. Cinnamaldehyde, a chemical found in cinnamon, has been proven to suppress the formation of amyloid beta plaques in the brain, which is a significant factor in Alzheimer's disease. Researchers also looked into all cinnamon components, including eugenol, cinnamic acid, and cinnamaldehyde. Because of its antioxidant characteristics and ability to prevent amyloid plaques, they discovered that eugenol had cognitive protective effects. They also discovered that cinnamaldehyde and trans-cinnamaldehyde had anti-cell death and anti-inflammatory properties that protect against cognitive impairment in animal models. Number 2, sage. Sage, a spice known for its strong aroma, may boost cognition and aid in treating Alzheimer's disease. In fact, according to a 2017 scientific review, sage includes chemicals that may be good for cognitive and neurological function. Be sure to include this wonderful herb in your favorite recipes, like butternut squash, roasted chicken, tomato sauce, and white bean soup. Sage can also be drunk as a tea. Number 3, turmeric. This spice is not only beautiful and tasty, but also nutritious. Turmeric has long been utilized in Ayurvedic medicine. It contains curcumin, a substance with antioxidant and anti-inflammatory properties, 2 factors that may benefit brain health and overall health. According to a review published in 2010, preliminary research indicates that turmeric may improve brain health and prevent Alzheimer's disease by cleaning the brain of beta amyloid. Furthermore, turmeric may protect brain health by slowing the destruction of nerve cells. Try adding curry powder or turmeric to stir-fries, soups, and vegetable dishes to increase your intake. Add a few dashes of black pepper to boost turmeric absorption. Number 4, ginkgo biloba. Ginkgo biloba has long been used as a dementia cure and is widely recognized for its benefits in traditional Chinese medicine. This herb is believed to improve cognitive performance by stimulating circulation and increasing blood flow to the brain. Some of the studies show that ginkgo biloba may improve cognitive functioning in patients with Alzheimer's disease or moderate cognitive impairment. In a study review published in 2005 in the Journal of Alzheimer's Disease, it was shown that ginkgo biloba extract may be particularly beneficial in slowing cognitive decline among individuals with neuropsychiatric symptoms, in addition to cognitive impairment and dementia. Number 5, lemon balm. Lemon balm, a tea commonly used to relieve anxiety and sleeplessness, may assist in boosting cognitive function. In a 2003 study published in the Journal of Neurology, Neurosurgery, and Psychiatry, 42 individuals with mild to moderate Alzheimer's disease were randomly assigned to receive either a placebo or lemon balm extract for 4 months. At the end of the research, individuals administered lemon balm had much better cognitive performance compared to those given the placebo. And with that, we've come to the end of this video. Please let us know in the comments section if you've been using any of these natural remedies. Also, give the video a thumbs up and share it with your friends if you enjoyed it and found it helpful. Subscribe to our channel to get more amazing and helpful content. Until next time, bye.